Hello, everyone. Today we are going to briefly discuss about topic regular blood tests for healthy heart. So we commonly encounter this question among our OPD patients and general public that what investigation should we do to predict our risk factors for heart diseases? It is age old saying that prevention is better than cure, and increasing prevalence of heart disease among young people, it is important that people should start screening themselves for possible heart disease in future. So the way which we can do this is routine investigations. So I'm just briefly going to tell a few investigations to you, which are important to predict your risk for future heart disease. So investigations can broadly be divided into invasive blood investigations and other non-invasive investigations. So starting with investigations, basic non-invasive among non-invasive investigations is hypertension monitoring, or in common way we say blood pressure monitoring. So blood pressure monitoring is a very easy method of monitoring blood pressure, which can be done either by digital devices or by mercury blood pressure monitors. It can be self-monitored, or monitoring can be done by a physician or a trained per health care provider. So, in blood investigation, we measure the blood pressure of our heart, which has two components, which is systolic and diastolic component. And the normal values are 120 for systolic and 80 mmHg for diastolic. So, if your blood pressure recording at hospital setting or at home comes abnormal, you can wait for another reading. If both of your readings, which are usually 4 to 6 hours apart, come abnormal, then from heart disease, and or you may have a heart disease in future. So you will have to consult a physician, and adequate life can be done. Another investigation which is important predictor of your heart disease is lipid profile, or in common man's term, you say cholesterol, blood cholesterol. So it has various components: total cholesterol, triglyceride level, LDL level, or HDL. Generally, LDL is considered as called in common words as bad cholesterol, and its usual values are 70 to 130. If it comes raised or more than 130, then it is a thing to worry about. You may have to consult a physician, and its adequate lifestyle changes are required or need to be done. Another component is HDL, which is said to be a good cholesterol. Its values differ in male and female, and are around 40 in males and above 50 in females. So if you have a deranged or lower value of HDL, adequate lifestyle modification, unhealthy sedentary lifestyle, dietary habits needs to be done, and which may prevent you from having a future cardiac event. So coming from hypertension to blood cholesterol or lipid profile, another important investigation is blood sugar level. As you know, diabetes is increasing its prevalence among population, especially in our Indian population. So regular sugar monitoring is required. Diabetes is a disease which affects multi organs, right from your eyes to your toe. So, sugar monitoring affects your cardiac health to a great extent. It is a very simple test, doing a fasting blood sugar, fasting overnight, and early morning you can do your fasting blood sugar, which can be done by self monitoring through a glucometer, or in a lab you can do this test. If your fasting blood sugar comes raised, generally speaking, values of less than 100 are considered to be normal for a fasting blood sugar, and 100 to 126 are considered to be in the range of pre-diabetic. And if it comes to be in pre-diabetic range, it is a warning sign for you to improve your lifestyle and unhealthy habits, increase your physical activity, and decrease the mental stress. And Another investigation in blood sugar is your HbA1c, which tells your sugar control for last 2 or 3 months, and its values less than 5.7 is considered normal. 5.7 to 6.4 or 6.5 is considered in pre-diabetic range, and more than 6.5 you are labeled as diabetic. So adequate sugar control will help you in having a healthy heart and decreased cardiovascular events. So these were the main basic investigations which were required, routinely required to monitor or check your health of your heart, or having a healthy heart. Another investigations which you need to get it done along with these investigations are your renal function tests and liver function test. As we know, these are the two main vital organs, and they control your metabolism and have um, great relation with your body health and even your cardiac health. So, if you have deranged renal function test, there is a possibility that you may be in a risk of cardiovascular event, and adequate lifestyle modification and drug should be added along with liver function tests. Liver function tests raised your liver enzymes are also indicator for poor cardiac health or metabolic syndrome. You may be suffering from fatty liver and weight loss, sedentary lifestyle. These you need to give up on sedentary lifestyle, and adequate physical exercise is required. Another very specific investigation for your cardiac monitoring is highly sensitive CRP. Raised CRP value means that you are having inflammation or damage to blood vessels, which increase risk of cardiac event in future, and adequate intervention can be done in right time. So these were the basic investigations which you need to do along with these specific cardiac investigations, which are non-invasive, is an electrocardiogram, which tell electrical activity or heart, rate of your rate and rhythm of your heart. And if deranged, if you have a deranged value among all these, to another higher or specific investigations which can be advised by your cardiologist or physician is 2D echo. I think doing these investigations will sufficiently guide you about your future risk of cardiovascular events, and you may do adequate intervention at right time, and prevention, which I said is always better than cure. Last word of advice will for and concluding this brief introduction about blood investigation for healthy heart. I will say give up your on bad or unhealthy habits, improve your lifestyle, do routine exercises around 30 minutes, 5 days a week, and yes, of all, have a healthy mind, decrease stress, and you will definitely have a healthy heart. So I'll conclude with this. Thank you.